Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, July 14th. We are joined today by Yukon Premier, the Honourable Sandy Silver, and Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is provided by Mary Thiessen and our French language translation by André Boursier. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Premier Silver?
Thank you very much, Pat. Hello, everybody, and thank you for joining us here on the traditional territory of the Kwalindun First Nation in the Ta'an-Quachin Council. I'm very pleased to be here with Dr. Hanley and Mary and the team. We are now 6 weeks into our current COVID-19 outbreak. This continues to be a serious situation. We lost another Yukoner to COVID-19 this week. This is incredibly sad news. And on behalf of the government and on behalf of all Yukoners, we want to send our sincere condolences to the friends and families of this individual. This is the 4th death from COVID-19 since the start of June, and sadly, the individual was unvaccinated. This is a stark and tragic reminder of the importance of getting vaccinated. There's no denying that vaccines save lives. Every single person that steps up and takes their shot is helping to protect not only themselves, but their fellow Yukoners as well. And I want to thank each and every one of you for your efforts. As of Monday, 85% of eligible Yukoners have received their first shot, and 77 have received their second shot. And this is phenomenal. And our youth are quickly catching up as well. 71% of Yukoners from the ages of 12 to 17 have received their first shot, and 53% have received their second shot. Also, very great to see. And again, I want to thank each and every one of you for stepping up and getting your shot. You're helping to protect your friends, your family, members of the community at large. These numbers are extremely encouraging, but we absolutely need to get them higher as well. You can still get your shot if you haven't already. The clinic is open here in Whitehorse Tuesdays to Fridays for all ages. There is a youth clinic in Ross River today from 3 to 5 and at the Ross River School. There is a clinic in Dawson City tomorrow at the Community Health Center, and there will be a clinic in Watson Lake on Friday and at the Community Health Center there. You can find more information and book appointments. All that information is available on yukon.ca. I want to again thank all of the leaders in the communities throughout the territory who have taken their shot, talked about it, and encouraged others to do the same. We've had a great, wonderful opportunity here to have Grand Chief Peter Johnston and Kwalindun Chief Doris Bill join us for updates over the few weeks. And they've been getting the message out as well about how important it is to keep Yukoners safe. There are leaders in every community, right across the territory, that have been spreading this message, and we owe a debt of gratitude to them, and we need to keep this up. The vaccines are keeping our territory safe and allowing us to live with COVID, and we have to recognize that it's not going to go away anytime soon. All we can do is to take the steps to keep each other safe and protect the health and safety of all of our fellow Yukoners. And the most critical step is absolutely to get vaccinated. Simply put, the more people that get vaccinated, the safer this territory will be. Other important steps, following the Safe 6+1, washing your hands often, maintaining physical distance, staying at home if you're sick, traveling responsibly and respectfully, self-isolate as required, and also following the gathering guidelines. Masking up, still very important. The current outbreak has aggressively targeted the unvaccinated so far, but we know it has spread because people were not following the Safe 6+1. These are still important and help us to contain the spread of COVID-19, especially staying at home if you're sick. We have a self-assessment tool online. If you have symptoms, please use the tool to see if you should get tested. We have increased testing capacity and have made it more accessible. You can find information about how to get tested on yukon.ca. We have been deploying rapid testing teams to communities to help detect and to contain the spread of COVID-19. And I want to thank every community partner who have helped with these efforts, which have been very, very effective. We are seeing a slow but steady decrease in cases. More than 300 individuals have recovered over the last 6 weeks. This includes the young children that tested positive a few weeks ago. I'm very happy to say that the situation with our youngest Yukoners has stabilized. We asked parents to keep their children home to help ease the burden on the daycares as we worked with operators to stop the spread. This has been successful, and following the recommendations of the Chief Medical Officer of Health, daycares will now be able to welcome all children again starting Monday. I want to thank all of the daycare operators for working with our public health officials over the last few weeks to address the spread. Thank you very much. I also want to thank all of the families for their patience and understanding as we deal with this situation. I know it hasn't been easy. It has not been easy for anyone. We have been dealing with an unprecedented number of cases, and our resources have been stretched thin. This week, the federal government approved our government's request for assistance to support our COVID-19 response. Additional public health professionals are here, and more are coming. They're coming to the territory to help with coordination and contact tracing, social supports, to ship laboratory equipment and personal protective equipment as well. This will boost our testing and contact tracing capacity and also ensure that we can continue to provide critical social supports in our communities. I want to thank Public Service Minister Bill Blair, Health Minister Patty Hajdu, and Northern Affairs Minister Dan Vandel for approving this request. I also want to thank our provincial partners who have been providing support to us in our time of need as well. I know that my officials and I are extremely grateful that we can count on the support of Canadians across the country as we deal with this unprecedented pandemic. Thank you. And thankfully, our case count is coming down. We are in a much better position than we were last month. As a result, organized gathering sizes can return to 200 individuals inside and outside, provided social distance is maintained and masks are worn indoors. We know that unorganized gatherings pose a greater risk for spread, especially when unvaccinated individuals are involved. If you are socializing with fully vaccinated people, the risks are quite low, and it's okay to return to group sizes of 20 indoors and 50 outdoors. If you're gathering with unvaccinated people, you need to stick to the 6 for the time being, because these pose a much greater risk for spread. Each of us have a role in keeping our territory safe because our individual decisions impact the health of everybody in our community. Doing your part to contribute is important as we emerge from this pandemic. Now, Dr. Hanley will be providing additional details about the current situation in a moment, but as I say, we are getting to a better place. Our daily case count has been decreasing. Our vaccination uptake rates are increasing, and that is exactly what we need to see. And we're confident that we're getting through this. And if this trend continues, we will be lifting the state of emergency next month. This will mean that all restrictions introduced under the Civil Emergency Measures Act in response to COVID-19 will be lifted, and we can focus our efforts on recovery. Each and every one of us have a role in playing to get there. By getting vaccinated, by following the Safe 6+1, that's what we're urging Yukoners to do. That's what's going to get us there. So please, continue to do your part and engage and encourage with others to do the same. We are all in this together, and we all will get through this together. So thank you very much. Dr. Hanley.
Thank you, Premier. Good morning, bonjour tout le monde. In just 5 weeks, as we were hit with a violent wave of COVID-19 for the first time in Yukon, our resiliency as a community has been tested. Our case numbers soared to heights that no one expected as the virus swept through all corners of our territory, targeting those who were most susceptible. In 5 weeks, we have lost 4 more Yukoners, seen 38 people hospitalized, and sent 13 people south for intensive care. As we transitioned into Yukon summer, this is not what anyone had hoped for. There is one very important thing to keep in mind, though. If we did not have our current high levels of vaccination, the impact would certainly have been far worse. We may have seen outbreaks in long-term care facilities. We likely would have seen much more spread and much more infection amongst our elders, dozens more hospitalized, and many more deaths. Vaccine has saved us from a worse fate, but the remaining numbers of people susceptible to the virus have still been an open invitation for COVID-19 to enter and set up shop. 5 weeks, 414 cases, 38 hospitalizations, and 4 deaths later, it is time to take stock of what has happened and what is next. Through these painful few weeks, we have all risen to the challenge. If there is a lesson from this time of hardship and loss, it is that even with high vaccination rates, we cannot yet let down our guard. That is our reality, and we must continue to act with the appropriate measures to carry us safely through. Now, for the status of cases. As of yesterday, there were 93 active cases of COVID-19 in the territory. 317 people have recovered since this wave began. 4 Yukoners have died since the wave began in June, and 6 overall since the onset of this pandemic. Our daily case numbers have steadily dropped in recent days, from a high of over 20 per day to now just a few. As of yesterday, the numbers of people in hospital, as I said, 38 people have been admitted to hospital and 13 have had to be medevaced out of territory for further care. 3 people, as of yesterday, remained in hospital in Whitehorse. Of our 13 people medevaced out, 11 were unvaccinated. One of the vaccinated was evacuated for non-COVID reasons, and the other was an elderly citizen. Of our 4 deaths, 3 were unvaccinated, 1 partially vaccinated. Of 38 people hospitalized, just 4 were fully vaccinated. Of the cases since June 1st, 86% are those who were unvaccinated or partially vaccinated, 13% fully vaccinated. Now, it's expected that in a large wave with lots of virus around and many vaccinated adults around, that you will see fully vaccinated people getting infected. It is actually simple mathematics that when you have those 2 conditions, that is a natural consequence. It is almost as if there are too many vaccinated people standing in the way as the virus seeks its targets. But we are seeing that the majority of these people have mild symptoms and recover quickly. Vaccination means a 90% reduction in your risks of infection and your risks of serious disease. It is not 100%. So you should proceed with confidence, but recognize that in certain circumstances, you still can get infected. If you are unvaccinated, though, there is very little room for escape. To stay safe, you must follow all the current public health measures closely and without room for error. If you are unvaccinated, it is likely that eventually this virus will find you. Because we know that this pandemic is not yet over and won't be for a number of months to come, this outbreak was primarily fueled by this particular outbreak here was fueled by the Gamma or P1 variant, with 240 cases and counting connected to this strain. We know that the Delta variant, meanwhile, is gaining traction in the United States, and most other Canadian jurisdictions. I expect there will be other variants that make their way here that we know little about today. The good news so far is that the vaccines are proving to be highly effective against the current variants, and this provides us with our best path forward. If you have not yet received your vaccine, please do so. I can assure you that this virus will continue to take any opportunity that is provided to infect as many Yukoners as it can. It does so all the easier if you are unvaccinated. Our case count may have stabilized for now, but of course this does not mean the risk has gone away. We're grateful also that relief has come to some extent from generous individuals and other jurisdictions around the country. Our workforce is still tired and stressed, though. Incoming relief of nurses, social workers, testing staff, and lab and support workers will still be welcome over the weeks to come. Recovering from a large wave such as this will take time, and our workforce needs to rotate through some well-deserved rest and vacation before the fall arrives. Even as we work our way through this current wave, we must all work together to prevent the next one. That means ongoing vaccination, observance of current public health measures, including Safe 6 and masking, and self-isolating and getting tested as soon as symptoms appear. Since I was here last week, I'm pleased to report that the cases associated with daycares in Whitehorse are under control, and most cases now have recovered. I know that these past 2 weeks have been increasingly difficult for parents, families, and daycare operators, as they have had to respond to these exposures and infection within daycares. The response has involved a rapid adaptation for many to seek alternative ways to care for their children. For many, this has meant on short notice working from home or taking an unplanned vacation. Your efforts have shown as our situation is now well contained and manageable. Therefore, I'm pleased to add to the Premier's comments around the daycares, and with them under control, that I recommend that daycares transition back to full capacity as of Monday, July 19th. Parents can feel confident in returning their children, who are not symptomatic, of course, to daycare as of Monday. For the time being, as children transition back, we continue to ask all staff to wear a mask while interacting with children to prevent any possible transmission of the virus. Recognizing once again the importance of daycare staff not going to work sick, we will be asking all operators to ensure staff understand and acknowledge the consequences of coming to work while ill. Operators will be advised to ensure that staff are screened daily for symptoms, and all staff should closely monitor for symptoms and not work when symptoms appear. Though our situation has substantially improved, it is important to remember that we are not done yet. This wave has hit us hard. Even with our vaccination rates that are the envy of the world, it is clear that enough people are still susceptible to the virus that our systems can be overwhelmed. So how do we prevent this happening again? How do we navigate the way forward and recognize that the difference in risk between vaccinated and unvaccinated people is about tenfold? We have to recognize that people who are vaccinated can gather more safely than people who are not. If you are vaccinated, mixing with other vaccinated people, the risk of acquiring COVID is very, very low. If you are unvaccinated and mixing closely with other unvaccinated people, the risk is substantially higher. But that risk is lowered when other public health measures are maintained, such as masking and physical distancing. It is in recognition of these combinations of risk factors, vaccination and adherence to public health measures, that I now make the following recommendations. For organized gatherings, I recommend that effective immediately, these may resume to the May 25th limits with close adherence to current measures, masking indoors, adherence to physical distancing, and observing the maximum numbers prescribed in current guidelines, 200 indoors and 200 outdoors. Remember that this applies to organized events in public settings, funerals, weddings, and other ceremonies. For informal social gatherings, it is time to pay very close attention to vaccine status wherever possible, your own status and others with whom you mix. If you are mixing with unvaccinated people, continue to keep contacts small. Stick to 6. When everyone is vaccinated, you can continue to gather up to the current limits of 20 indoors and 50 outdoors. Remember that the written rules have not changed under CIMA since May 25th. What I am saying is that the temporary pause in larger social gatherings is now no longer necessary if you and your companions are fully vaccinated. When unvaccinated people are in your group, I strongly recommend that the stick to 6 is taken to heart. It is especially important that we continue to align our public health measures with where we are seeing the highest risk of transmission. As I said, we have been seeing some vaccinated people taking a hit, but we are primarily seeing spread through social networks and gatherings of mostly unvaccinated individuals who are partaken or who did partake in unorganized gatherings. So for the time being, I still recommend that if you are unvaccinated, you should stick to 6, keeping your contacts small and consistent as much as possible. Knowing what gatherings are safe to attend and when to stay at home will require practice. Assessing our individual risk will become a tool that we will become more used to. Things such as age. The older you are, the higher your risk. The presence of symptoms, vaccination status, overall age and medical conditions, overall health and medical conditions, size of gatherings, whether inside or outside, how well ventilated, how familiar the context is, whether or not masks will be worn. All of these are factors that can be weighed into the pros and cons of attending an event or venue. It will be helpful for us to think through these things before deciding whether to attend a party, a community event, or even a dinner with friends. By asking key questions before going to a party or even a small get-together, we can provide that peace of mind and help curb potential transmission. It may feel awkward to pop the question, "Can I ask if you are vaccinated?" And perhaps if we get close to 95% or higher uptake, the question will not be as relevant. But for the time being, I invite you to consider the vaccine status of people that you mix closely with, and think through those other factors that may lead a situation to be higher or lower risk for transmission. As we transition further into reopening, I hope we can help bring you tools for personal risk assessment. Like the Premier, I'm pleased that people continue to come forward for first doses of vaccine. And our 12 to 17-year-old youth have responded magnificently to the call to get immunized against COVID-19. The uptake numbers are truly impressive. And at the same time, we know from this experience that to prevent another wave that could be even worse than this one, we have to continue to decrease the size of our susceptible population. We cannot yet vaccine the under 12-year-olds, but if we can get our 12-plus population to 95% and maintain that goal, the numbers of susceptible people will be substantially smaller. Think of it this way. The number of Yukoners aged 12 and over is about 37,000. About 28,000 have received 2 doses of vaccine, 76%. Fantastic progress. Yet, that still means about 9,000 people susceptible to infection. If we have a wave that will infect about 500 people, as in this one, we would have to go through this same wave 18 times before everyone gets infected. I'm not sure anyone wants to go through this even once, let alone 18 times, with 18 times the number of people who die or who require prolonged intensive care. But if we can get to 95% uptake, that would be 35,000 people vaccinated, leaving just 2,000 susceptible. You can get the idea how much harder it would be for the virus to overwhelm us again if the pool were that small. As we look ahead, these are the goals that we need to set to emerge from this emergency: a very high vaccine uptake and careful adherence to whatever stage of the pandemic measures we are in. For now, that means we can gather, but we must gather with care. We must stay away from workplaces and other public settings when sick. We need to get tested when symptoms appear. And Safe 6+1 must stay in place until we can look forward to the next steps towards the end of the emergency and towards living with COVID risk. COVID, unfortunately, is here to stay, and we must use the hard lessons learned from these past few weeks to learn how to manage the year ahead of us and more. That's it for today. Be kind, stay patient, and stay strong. Stay together above all, and stay well. Thank you. Shonitan. Masicho, merci.
Thank you both. We'll now go to the phone lines, and we'll begin with Luke from CKRW.
Hi, Dr. Hanley. I'm wondering if you anticipate something like a mask mandate being slowly altered as opposed to being removed altogether as we move towards the possibility of more restrictions being lifted.
Thanks, Luke. I think what we will see again, and I think it comes back into that risk assessment, is I think masks should always, at least for I think years to come, should be a tool that we keep. But I see that I would anticipate that we would be moving away from masks as a mandatory measure to a tool that we use based on a risk assessment for certain settings. And so it may be, so for instance, the types of indoor gatherings where you may be unfamiliar with the circumstances. There may be, you're not sure about the ventilation, you're not sure about vaccine status, and you're going to be there for a while. Maybe a mask would be an appropriate thing to do. Maybe a mask, as in many Asian cultures, if we can rule out active COVID infection, but there are mild symptoms present, maybe a mask will be a handy tool that we use just to prevent general respiratory spread to others. So I think we will get smarter and more selective about where masking makes sense, and keep people comfortable with using a mask in those circumstances, rather than making it a government mandate.
Thank you. Do you have a second question, Luke?
No, just the one question for me. Thank you.
Thank you very much. We'll move now to Haley, Yukon News.
Thank you. For my first question, obviously before the most recent outbreak, we didn't have that many COVID cases comparatively. Now that we have more, I'm wondering if the government is doing anything to track possible cases of long COVID or symptoms that continue, and if there's any support for those people if they're out there.
So it is an area that I think we have to take up more actively and systematically. It's not an area that we have formal surveillance for, but it is something we have a close medical network, including our pediatric colleagues. So it is something that's actually quite easy to track. We don't have as yet reported cases. However, recognizing that it's also not a reportable disease, and the definitions still really have to be defined as to what constitutes long COVID and what doesn't. This is an area that is evolving in terms of what fits a definition of long COVID. I think it's so it is important that we keep it on our radar and we establish, with the rest of the country, mechanisms for definition and surveillance, and then appropriate follow-up and care. Of course, people always do have access to primary care supports if symptoms occur that might be compatible with long COVID. And of course, the best treatment for long COVID is prevention with vaccination.
Thank you. Do you have a follow-up question, Haley?
Thank you. Yeah, I did have a follow-up question. I'm just trying to square sort of the two messages from this press conference, that there's caution required right now, and it's still important to follow all the public health advice, with the news that we might see the state of emergency ending next month. I'm wondering if you can just clarify what the criteria would be for ending the state of emergency. Do cases need to be down to zero? Do vaccination rates need to be at a certain point? If you could just provide a little more detail, thank you.
I'll start by just saying, with the ending of the Civil Emergency Measures Act and the state of emergency therein, that would mean that all of the restrictions that are introduced will be lifted. As far as how we move forward, as we go from relief to recovery, as we go from pandemic to endemic, it's not a magic number necessarily. It's still, as what we've been hearing for over a year and a half now, it's a strain on the medical community and our assets. But I'm sure Dr. Hanley would have more on the specifics about what would be concerning moving forward on outbreaks.
Yes, and I agree. It's really looking at a whole transition into a new way of living with COVID, of course. So it doesn't mean that we need to have zero cases. We again do have criteria in the path forward for being able to move forward, and it means that we are confident in our public health capacity, in our healthcare capacity, in our ability to test. And that our importation risk is under control, and that our cases are manageable. And so I think it does not mean that we have to be necessarily to zero active cases. I think it means that we have all of the mechanisms in place, and we feel confident that we are able to handle the impact of additional of an additional influx of cases or a potential surge on the system. So that, when there's no more SEMA, it doesn't mean that we don't have tools anymore. It means that we are integrating COVID control into our normal our normal way of handling communicable disease control, with the additional tool of vaccination. So it's really using those tools we have always had for communicable disease threats, in terms of information, surveillance, the flexible use of public health measures that might be more on an individual basis, and combined with recommendations from myself or my office, and testing capacity, and then those abilities to surge resources should we need to. So really we have many tools going forward in looking forward to living with this ongoing threat. But we will get to a stage where we no longer need the heavy hammers that the SEMA have afforded us.
Thank you. We'll move now to Amy, Canadian Press.
Hi, Dr. Hanley. I'm just curious, given that you're giving slightly different recommendations on personal gatherings depending on your vaccination status, I'm curious about whether you consider doing the same for the organized gatherings, and if you think it's equally safe for unvaccinated people to gather in groups of 200 indoors with masks as it is for those who are vaccinated.
Yeah, thank you. I think the key word is organized, and really what we've always tried to make a distinction between is informal and informal being spontaneous social backyard or in-house gatherings amongst friends and known social contacts, and allowing for that normal need for us as humans to gather without necessarily having a plan and a list and all the organizational aspects that go into the more formal types of gatherings. So clearly, an organized gathering of, say, 200 people, and all of those people were fully vaccinated, yes, I would be much more comfortable with that being as low risk as possible, especially when combined with the other measures. But this is why we have the requirements in place for the other public health measures. I think it's if you get into making distinctions in formal gathering between vaccinated and unvaccinated people, then there are many other considerations in terms of verification, equity. How would you actually monitor or control who becomes the holder of that information? So really, to make things simple and workable, the concepts of organized gatherings are absolutely, the more people vaccinated, the better. But there are these other measures in place for expected adherence to public health measures as those additional layers of protection and risk reduction.
Thank you. Do you have a second question, Amy?
Yes, I do. I think this is for the Premier. Alberta Premier Jason Kenney has said he'll be advocating for the border to open during his next conversation with the Prime Minister. Given that you're kind of looking ahead at the end of ending the state of emergency next month, I'm wondering if you'll do the same, or whether you're hoping for some certainty for the tourism industry and that kind of thing. Basically, kind of what's your position on the border?
Yeah, great question. We've been advocating for the safe opening of the border for a while now, but again, that's the main word of safe. We've also been advocating for more symmetry when it comes to the two nations as far as the rules about going back and forth between those borders. I spoke with Governor Dunleavy of Alaska yesterday and let him know that Minister Bill Blair was asking about one-offs, and we've mentioned both at the Council of the Federation, the First Ministers' meetings, and to individual ministers as well, that communities like Eagle, Alaska, Haines, Alaska, and Skagway, Alaska have huge family connections. Folks, Yukoners, have assets in those communities, and of course families and friends. So that conversation of, if you are considering one-offs, then you should be looking to these. I know that every jurisdiction, a lot of jurisdictions in Canada, the ones that have border connections, all have similar concerns about specific individual communities. But on the bigger picture, yes, we've been definitely having lots of conversations over the last few weeks about when and how, and making sure that the communication is done properly with the provinces and territories. So we have a conversation tomorrow with the Council of the Federation and with the First Minister's meeting as well. And so we assume, based upon all the information that each region has been giving into the federal government over the past few days and weeks, that we will hear the results of those conversations. Again, each of the premiers have done a fantastic job, in my opinion, of taking to the federal government not only their political point of view, but also what their chief medical officers of health have been saying to them about what it means to open those borders safely. And I can't reiterate how important that is. And I think that we're going to, we'll see what happens tomorrow as far as the information from the federal government.
Thank you. We'll move now to Tim, Whitehorse Star.
Yes, good morning. My first question is about this new goal of trying to get about 95% of people vaccinated. So I guess this is for you, Dr. Hanley. How do you propose to do this? These will be the more hardcore resistant people to the vaccine. Are you going to need a different strategy to try to deal with them?
Yeah, thank you for that. And it's an aspirational goal, I will say that. And we just need to see if people will take up the gauntlet and if we can get there. I think that, as said, these have been a sobering few weeks, and I think a lot of people have paused to take a look and understand the impact that a wave of COVID can have on a small jurisdiction like ours. So I think that in itself has provided some some additional incentive for the people who are waiting or holding back to come forward. But I do think it's time to look at all possibilities. I think we can look for other ways that we can outreach with vaccination efforts. That we can engage with the public on what is needed or what will work for them. But I do think it's time to look at what have we not done yet that other jurisdictions have found to be successful. So I do think it's going to take some collective action for sure, both from the community and from government and from our partners. And we need to, and now at this stage, while we congratulate ourselves on how far we've gotten, and it is truly impressive, look at how do we lead the way for the next 15 or 20%.
Premier Silver?
Yeah, I would just echo that, but also, this is best case scenario is 100% vaccination. Will we get there? No. I mean, Dr. Hanley has mentioned in the past that he believes that there's probably an estimate about 5% of the population who, for medical reasons, medical conditions, can't get vaccinated. So 95% is the goal of all those that are hesitant. What you're going to see not only in Yukon but across Canada and internationally is a shift from government regulations and restrictions and enforcement, and a shift towards an onus on individual responsibilities. And that's where the new normal is going to go. So the fact that we have people who want to get vaccinated but can't for some medical reasons is being taken into consideration with this number. But it makes it all that more important that everyone that can get vaccinated do so. So this is how we're going to protect everybody in the community. We've been speaking with chiefs about this as well. Leadership is not just elected officials. Leadership is in every single community. Having that conversation at your dinner table, talking about the new normal. I mean, I think Dr. Hanley really painted the picture today about how this virus will actively seek out those who are unvaccinated. And we are going to go as a nation and as the world, basically, to a place where the restrictions are being left and the responsibilities of the communities are going to be really important as we move forward.
Thank you. Tim, do you have a second question?
Yes, I do. This will be for the Premier. With more and more Canadian jurisdictions either embracing the idea of a vaccine passport or rejecting it, where do we stand here in the Yukon on this?
So we've already talked about how if you're unvaccinated and you're traveling into the Yukon or returning to the Yukon and your requirements for self-isolation versus if you're not vaccinated, how you don't have to self-isolate. That's where we are right now. I think what we're seeing is right across the country is as we lift these government restrictions right across the country, we will be in a place where the need for an internal passport will be gone. So we've presented on the national stage as the jurisdiction that's ahead of the curve as far as vaccinations, about our concerns about having that system set up, and if it's going to happen or if it's necessary to happen, how it would make sense to have a unified system so that there's less confusion. But as you do notice, Tim, in other areas, we're seeing a complete lifting of restrictions. We have a goal here as well to lift our restrictions as well. So in those cases, the concept of an internal passport would be less necessary.
Thank you. We'll move now to Julian, CBC.
I just have a couple of questions about the vaccination rate goal. The word is 95% now. However, vaccination uptake varies by community, by communities, and in Whitehorse comparably. So the rate in Central and Southeast Yukon is still below 70%. Can you sort of address what will be done for the communities where vaccination uptake is concerned?
Yeah, thank you. I think that's a really important question because the ideal is that it's not just overall 95%, but that is a uniform 95%. And because then we are able to decrease the susceptibility of any pockets of unvaccinated people, including communities with low vaccination uptake. So we are continually working with and engaging communities, and have supported all the communities through through these recent weeks, whether or not they have had cases. As you know, most communities have had cases. And we've been right there with them, with conversations, with one-to-one conversations with chiefs and mayors, or through chief and council, or through their communication contacts, in just staying in touch and making sure that their questions are answered, and of course, in many cases, offering that rapid testing support. So we are, we are there, and we have seen renewed interest around vaccination in some of these communities that have been hard hit, and we'll continue to plug away. And again, I think that's part of the I think a renewed effort at what are we not doing that we could be doing. What could we be doing that we're not doing? Just continuing to engage in what would work for particular communities, and recognizing that part of that is just that patient and sometimes long process of building trust and building confidence and keeping those lines open. So I think it's also about community readiness, and so part of our work has been just helping communities get prepared for the what if. What if there were lots of cases? What if there was widespread transmission? How do we work together? And I think you have seen that through our efforts, through contact tracing, through case isolation, working with the communities, we have managed to contain spread. So we do have all our other tools as well, and we will continue to work side by side with communities for protecting them when there is a threat.
Thank you. Do you have a second question, Julian?
I do, and this one is best answered by Hanley also. I know that you touched on long COVID earlier in this presser here. And my question sort of riffs off of that, and it sort of seeks to address reinfection. If somebody has been grappling with long-term side effects of COVID-19, have you looked into the propensity for reinfection? Is that work happening in the Yukon? Yeah, can you just sort of address that point, please?
So if the question is about the relationship between long COVID and reinfection, I think I couldn't give you specific information on that. I clearly, long COVID is under study, as is the whole immunology of infection, and how long that lasts. What are the characteristics that enable shorter or longer term protection against COVID once infected? There is confidence, certainly, that at 3 months and even 6 months or beyond, that previous infection does protect against further infection. As to whether long COVID alters that, I can't think biologically of a reason why there would be an alteration in that, but perhaps there is. I'm sure that's under study. It's not something that we do not have that clinical scientific capacity to study specifically here. That would be a subject of research more at academic centers who have that capacity for following long COVID. But clearly, we will look forward to learning from emerging research around long COVID, and including the relationship between immune status and ongoing presence of symptoms.
Thank you. And now we will go to Vincent at Radio-Canada.
Oui, bonjour. Une question en français pour le Dr Hanley. On parle justement de l'objectif de 95% de vaccination, et c'est un objectif élevé. Et en Europe, à ce moment-là, on commence déjà à parler d'une troisième vaccination peut-être à l'automne. Est-ce que c'est des discussions que vous avez déjà et qui est une possibilité aussi pour le Yukon?
So, at this point, given your objective of 95% vaccination for first and second doses, and that in Europe right now there's a lot of people talking about a third round of vaccination, is it something that you're considering for the Yukon at this point?
Oui, donc il y a deux histoires en fait. Première histoire, c'est pour avoir un taux le plus haut possible pour les premières deux doses. Et ça, c'est donc l'aspiration pour 95%. Deuxièmement, c'est où est-ce qu'on a besoin une troisième dose ou une dose additionnelle. Et ça, c'est une question sous étude au niveau national. Et donc, oui, c'est en discussion et c'est sous analyse. Et on va suivre les recommandations de la Comité national du Conseil d'immunisation, comme pour tous les autres offres d'immunisation. Donc, oui, c'est une question qu'on va suivre avec intérêt. Éventuellement, je suis sûr qu'on aura besoin pour une troisième dose. Ça doit être... c'est possible que ça sera un calendrier différent pour les populations différentes. Par exemple, les plus âgés par rapport aux les plus jeunes. Donc, c'est une question pour le futur, mais c'est sous considération, c'est sûr. Would you like me to?
Yes, please.
So the question is about booster shot, and I said, there are really two stories going on. First is getting people, the most people possible, the first two doses, the dose 1 and dose 2 of our Moderna, and that's really our priority effort at the time being. Yes, there will almost certainly be need for a booster shot, and yes, we are in discussion with national counterparts on that, and we will eventually await recommendations at national level through the National Advisory Committee on Immunization for the third or a booster dose of vaccine. Many considerations there, including whether it would be the same schedule for instance, older people versus younger people. There could well be different recommendations based on the estimated durability of immunity, and of course that's an ongoing study itself. How long do the two doses give us reliable immunity for?
Thank you. Avez-vous une autre question, Vincent?
Non, je vous remercie, docteur, monsieur le Premier ministre. Merci.
Merci. Et maintenant, Marine, l'aurore boréale.
Oui, merci. C'est une question pour le docteur Hanley. Quand vous parlez de rassemblements sociaux qui seraient non organisés, qui doivent rester à 6, pour les personnes qui n'auraient, si le rassemblement n'a pas tout le monde qui est vacciné, est-ce que ça inclut aussi les enfants de moins de 12 ans?
Dr. Hanley, your recommendation for unorganized gathering that should stay under 6 people, does it include children less than 12 years old?
Donc oui, les jeunes sont sous-vaccinés, et donc quand on a parlé de le 6 pendant les dernières quelques semaines, on a parlé de 6 à la fois. Donc si on a des enfants, par exemple, dans une maison, et on reçoit des invités, donc les enfants doivent être séparés des invités pour avoir 6 à la temps. Donc c'est le même concept que je conseille. Mais c'est des conseils, c'est une recommandation, et c'est en reconnaissant. Il faut reconnaître reconnaît que le risque, c'est plutôt pour transmission, c'est chez les adultes. Donc, c'est vraiment pour dire que si on a un groupe de jeunes, une vingtaine de jeunes, et ils sont tous non vaccinés, oui, il y a un risque de transmission. J'ai beaucoup plus de soucis si c'était un groupe de jeunes adultes, par exemple, qui étaient non vaccinés et qui rassemblent de la même façon. Donc, c'est tout sous considération en reconnaissant que le risque chez les enfants sont moins que chez les adultes.
Avez-vous une autre question, Marine?
Oui, merci beaucoup, Dr. Hanley. Mon autre question est, certains événements au pays requièrent maintenant des preuves de vaccination pour laisser entrer le public. Est-ce que c'est quelque chose que vous pensez recommander pour les événements au Yukon?
So there are more and more events in Canada where they require a proof of vaccination to allow people to come in. Is it something that you're looking into for the Yukon at this point?
Non, pas cette fois. Il y a, en fait, pour la plupart des régions, c'est pas recommandé par les provinces, les gouvernements. Il y a des individuels, par exemple des organisateurs des événements qui obligent les gens d'avoir preuve de vaccin, par exemple. Il y a aussi un intérêt au Québec, par exemple, pour dans certaines circonstances où on a plus de transmission, qu'ils ont l'intention peut-être de demander des gens, de faire une division entre les gens vaccinés et non vaccinés pour participer dans les événements. Pour nous, la concentration, c'est pour arriver à un taux de vaccination assez haut que ce serait plus nécessaire de faire cette distinction. Aussi, on parle vraiment, c'est l'intérêt de parler de la vie après l'urgence. Et donc, qu'est-ce qui est praticable, qu'est-ce qui est logique pour les gens dans un état post-urgence et qu'est-ce qui sont pratiques. Donc, je pense le plus qu'on peut avoir un reçu de vaccin chez la population, le plus pratique pour tout le monde.
May I ask you to repeat that in English, please?
Sure. The eternal question of vaccine passports for attending local events. I think that this is an area that has many pros and cons, let's say. And I think the priority for us in our jurisdiction is to really get to as high an uptake of vaccine as possible, so it becomes a moot argument. And I think it's also important to be talking about life after the emergency and what does that look like. And I think that that's where it gets back to the personal risk assessment, I think, as being the more important tool than having another tool that has to be administered over the public when we really have no longer, we're looking to a time when we won't have orders and public health restrictions. So to me, it's not compatible with the way that we're going when we're really relying on individual responsibility, as the Premier was talking about, and a push to get people, as many as we can, vaccinated.
Thank you. I'd like to thank everyone for their time today. The date and time for our next COVID-19 update will be announced early next week.